की तकदीर वो खुददार होते हैं, हजारों डूबते हैं ना खुदाओं के भरोसे पर, जो खुद चप्पू चलाते हैं वो अक्सर पार होते हैं।
हेलो एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। आज मेरे साथ एक बहुत ही इंटरेस्टिंग पर्सनालिटी है। सर ने अपनी एमडी डर्मेटोलॉजी करी हुई है सीएमसी वेल्लोर से, जिसके बाद सर ने कुछ टाइम प्रैक्टिस करी अजमेर में, जहाँ उनके पापा भी प्रैक्टिस करते हैं। उसके बाद सर ने ब्रेक लिया और वो बॉम्बे चले गए बिकॉज ही वाज वेरी पैशनेट अबाउट एक्टिंग, सो ही स्पेंट अ लिटिल टाइम practicing as well as acting there.
Both the things together.
And then during COVID, when he could not pursue his passion for acting and stuff, so he moved abroad. उस टाइम पे भी उन्होंने बहुत सारे अच्छे एक्सपीरियंसेस गेन किए जो हम सबके लिए बहुत इंसाइटफुल हो सकते हैं। ही इज अ ब्रिलियंट क्लिनिशियन एज वेल एज अ ब्रिलियंट एक्टर। तो हम सर से ही सुनते हैं उनकी स्टोरी।
At the outset, I want to thank Dr. Aarushi Mittal for giving me an opportunity to have podcast with you, and
thank you.
I'm really glad that I met Aarushi, and by chance anyway we met in conference today, and instantly we decided to have a podcast. So let me tell you about myself. Like I'm a trained violinist. I learned music for almost 12 to 13 years.
Wow.
And I did beatboxing like when nobody was aware of beatboxing, and then subsequently, because being a child of a doctor, I was like I will not say I was pushed, but that was the only option for me in the beginning to have stability. So I chose medical as my career, and I was selected for government college. And then like while I was continuing my medical education, I was not sure that again I will get a second life or second chance to pursue my dreams. But finally, one day by chance, after my MD, while I was traveling, I was like, I'm just, singing some song, and like I got the idea, like why not to start again, because by chance I had good lyrics, and that was the beginning of my musical career. And I made my first debut and first song, which I only produced, I composed it. And after that, I had a spree of song, like multiple song I did. And finally, I realized that more than song, what I like is the acting part of that. Then I took professional training in theater. I did a lot of theater. I took a lot of theater training. I learned dance. I was in Mumbai, and I actually planned to, settle down in Mumbai. And but we know that nothing happens by choice. And then COVID came. And finally, I had to discontinue my journey of musical career as an artist, and then I went abroad.
So abroad, आप कहाँ थे?
Abroad, I covered central part of the Africa and the upper part of the Africa, the Morocco, Tunisia, and many other countries I traveled, and Ethiopia. And
so what were you basically doing there?
I already when in the incipience of COVID, I had to drop my musical and artist career. Although when I was following my musical career, I was practicing as dermatologist, and I was doing cosmetic surgery and everything. But when I got this chance to travel as a cosmetic surgeon, so I was doing surgeries there in camps, as well as I was training doctors. So that was the thing, but I enjoyed a lot.
So we were both discussing this on the way, that even if you want to follow an artistic career, sometimes you need a backup plan to fall upon, because all of this will require investment. So in case you don't have family support system, you can become something, maybe a doctor or like an engineer or a chartered accountant or something, and then pursue your goals, then pursue your hobbies and passion, because you might not be successful every time you try to become an artist, but you can definitely earn a good living if you become if you choose to go for a stable profession. So sir's story is an example of the fact that we can all go for multiple careers also.
Definitely.
We can change horses in between. and we can simultaneously continue our practice and also follow our passions. So in case you're somebody who's not very sure of how far they can go, this is a very, very safe bet. You can go for a regular career which will help you earn and stabilize yourself, and also then you will have good amount of money to invest, because sir was only telling that he's in touch with a lot of struggling artists.
Yes.
And not everybody makes it, not everybody gets to earn well. So in case you are not very sure, this is, I think, the right approach. One thing that I would want to know is, how did you continue your violin, practices and all with MBBS?
When I was doing MBBS, I will tell you a very interesting thing. I used to teach violin to my juniors and some senior doctors, and that was giving me some extra money also. So that is something which I did during my MBBS, but I was not sure that I will again come back in this field. And although I had a lot of professional training in dance, when I went abroad, then again I took training.
So
in salsa,
just after your MD, you were practicing in Ajmer with
yeah,
your
I practiced for 4-5 years. I was not having any idea.
During that time, were you practicing just clinical dermatology and the regular stuff?
No, everything I was practicing.
Cosmetics.
I've been training doctors right from the beginning in cosmetic and many other things.
Okay.
Yeah.
So when you shifted to Bombay, where were you practicing?
No, I will tell you one thing. Like, I shifted to Mumbai. That time I took a pause actually, but it was not I had an online thing also, and I used to come to see my patients, and I will go back. If I will go there and I will give my auditions. If the auditions are cleared, I will go back on those dates. I took an apartment there, but I was not living there continuously. So I was managing both the things at a time.
So clinic was in Ajmer only?
Clinic was in Ajmer.
But you would go there and take auditions?
Luckily, we had that time the Kishangarh airport near to me was having direct flight to Mumbai. So morning within 45 minutes, 1 hour, I used to reach Mumbai and then come back again. We can come back in the same.
But you said you were also taking acting courses with Anupam Kher.
Yes, that was in the beginning, 3 months. That is only 3 months.
So you took a 3 months gap. You did a course with Anupam Kher, and then you started taking auditions and stuff. Yeah,
auditions I was giving from the day one. That the thing, I took 4 years of theatre training. That was not in the Mumbai. But the Anupam Kher was that is in Udaipur. So everything that was
tell me about your journey in the Middle East. You were in Middle East.
Not Middle East exactly. It's Arabic countries.
Okay, in Arabic countries, when you were in Arabic.
French-speaking countries, yeah.
So, what was your source of income then?
As I mentioned, I was the same dermatology, same. My bread and butter was always the same. It has been the same. Yeah.
And you were teaching people as well.
Yeah, training.
So, do you think it's a better idea to go abroad and to practice there, or is it better to practice in India?
I would definitely suggest, if you get a chance to go abroad, you should definitely go, because you meet a lot of interesting people, and you get to see a lot of new cultures. So you become a different version of yourself. When you're in India, you're different, because now I am back. I am totally different kind of person now. May not be like my look, but from the way of thinking, everything has changed.
Your brain broadens a little.
Yeah.
Because you see other people working harder than you. You see other people doing innovative things, and then you're like, okay, we are just following the herd. So when you see a lot more people, when your sample size and all is more, your mindset kind of broadens.
There also a composed song with African groups.
Wow.
And we are going to even produce them very soon. We have music. We have already recorded music there also. Even with the Congo, the Central Africa. I did work with them. I learned bachata, salsa.
So for your songs and all, do you make your own investments?
Yeah,
or do you find producers all the time?
Yeah, it's because being a full-time dermatologist, I cannot go to the angel investors and all. I don't get time. I cannot, because there are a lot of scammers, so I cannot believe them. So obviously, maybe in the future, I may need producers, but right now I'm investing myself. It's my hobby. So people ask me, what do you get out of this? What I get out of this, I cannot explain in words. It's a beautiful feeling when you follow your hobby and you are capable of doing that. Because I'm capable of doing it, that I'm doing it. If I would not be capable of doing that would have been the end of my journey. Yeah.
Sir has also written 200 hours worth of lectures for UG students.
Yeah, I teach the PG students, MD students.
Oh yeah, PG students. Also, if you go and see his songs, they look so real. I was like, am I watching a Bollywood movie or something? And they have good number of views as well. So in case you want to know more about the person, behind. I mean, the person who's inspiring us today. You can visit Rudy Rahul Sharma.
Yeah, actually, I have chosen a different name as an artist because, I see patients. Patients search my name. I cannot be the same name as Dr. Rahul because it will be confusing them. They will judge me. So I have a separate artist name, Rudy Rahul Sharma. But if you search my name as a doctor, that is Dr. Rahul Sharma. So I have kept these fields totally apart.